Welcome to Tea Time and Incense with Vania. Sit back, pour yourself a cup of tea, light your incense, and let's get started. Hello everyone, and welcome to Tea Time and Incense with Vania. And so what we're going to touch on today is I took some really great photos of before and after on a case that I had treated on a patient. So I decided, you know what, let me make a video about it and kind of educate the public on what's going on. And it could also be something that you're going through, and I think it's important for you to know how to address it. So I decided, why not make a video about this? And what we're going to touch on today is inflammation as a whole, because as you know, inflammation is actually the driving force behind all diseases. And so if it's causing this amount of damage in an individual's mouth, just imagine what's going on with the rest of that body. So yeah, let's touch on that, and let's pour ourselves a cup of tea and light that incense and get started. So what I'm drinking today, it's a nice little mix of green tea and chai, and it's one of my favorites. It's so delicious, and it's chai, of course. It has that nice little kick to it. So yeah, I'm gonna enjoy this cup of tea while we hit today's topic. I have my incense burning right back there. Yeah, we got a little Nang Champa, and that is scented in rose. It's actually one of my favorite ones lately. I do like it, it's enjoyable. So today's topic is going to be on inflammation. I worked on a case with a patient for the past month and a half or so, and not the process took a month, like the whole healing process took a month for me to, from start to finish, from the start of the procedure until everything was, healed. And he still actually is still in the healing process. So I took some before and after photos, and I decided, why not educate the public on inflammation and what it means, especially to see pictures of a pretty good severe case of it, so you can kind of get an idea. And so I wanted to do that today and kind of give you guys an idea of what this whole process is. Inflammation itself, if you think about it, it's the driving cause in all diseases. If you have heart disease, or you have diabetes, or you have some kind of cancer, any of that is due to inflammation. Even when you cut yourself, if you look at it, you cut yourself and then it goes through a whole inflammatory response and then it heals. So let me go ahead, I'm gonna pull up these pictures and kind of go through with them with you guys and show you what's going on. So let me pull up my handy dandy laptop. Okay, so, all right, let's see. So this photo here, I want you guys to look at it. So what's going on here is you have all this redness around all this tartar. So what's going on is that tartar itself is hard as a rock. So because it's hard as a rock and it's sitting on the gum, it's almost like if you were to get a splinter in your finger, right? You get a splinter in your finger, if you leave it there, it causes inflammation. And as you can see in this photo right now, the inflammation is being caused because of that tartar, but it didn't start all because of that tartar. What begins first is leaving that plaque around the gum, and then when you leave that plaque around that gum, it just causes inflammation because plaque is nothing more than millions of bacteria. So let me show you this photo, for example, on his upper teeth. If I was to take a bit of that plaque off of that, where I'll show you, it's that white film. If I was to put that underneath the microscope, I would see millions of bacteria. And that bacteria, what it's doing, it's slowly breaking down the gum tissue and also causing bone loss as well. So there's a whole process that occurs because of all this buildup that's around your teeth. So if you've ever seen someone, and I want you also to be aware now when you see people, just to try to, even if it's yourself, point out, maybe I'm kind of at this point where I'm seeing some type of inflammation, because you're so used to seeing it in the mirror and looking at it, you almost start to think that it's just normal to have red gums or inflamed gums, or if your gums are bleeding when you're brushing your teeth, you think it's normal at this point. So what happened with this young boy, you know, he's 23 years old, he's a man, actually he's a young man, and he was very neglectful with his oral hygiene, and you can see how much buildup he has. Also, another underlying factor with him is he does have a lot of crowding, meaning he has crooked teeth. And so because he has crooked teeth, that also traps much more bacteria because there's no flat surface for your brush to actually brush around to keep it nice and smooth and clean. So that also is a running factor with making sure you have good teeth. And it's not, you know, straight teeth isn't only because of cosmetics, but it's also the health of your teeth as well. I'll show you like the after photos after we cleaned everything up and also during the process. So you can see here on this photo here, after I removed that tartar, you can see how much inflammation is below that gum line, and that's just, it's super fiery red. And it's fiery red because of all the bacterial process that's just breaking down everything else. So what's going on right now is, now that we've removed this bacteria and we've cleaned all that bacteria out from below the gum line, we're gonna allow this gum to heal and shrink. This patient is also going to be on Paradex, which is, it's like an antibiotic type of mouth rinse that he's gonna be rinsing with to decrease the amount of bacteria in his mouth so that everything heals easily and efficiently, I should say, more efficiently than anything. So we put him on Paradex and also having him improve on his home care. I personally, as a dental hygienist, I actually give my patients that are in this case some disclosing solution. Disclosing solution is pretty much, it's like, it's a solution that stains your teeth and it shows where all the plaque is, just so that you know you're not missing anything. So like when you brush your teeth, you know, I usually tell my patients, you know, do it maybe like once or twice a week to see where your progress is with your brushing. And so what I'll do is I'll have them go ahead and disclose themselves, see how much plaque is on their teeth, see where they're missing so that they can kind of stay on top of it. On top of that, I also recommend that he uses an electric toothbrush. I'm a big soul believer of Sonicare. I've been using Sonicare since I was, I want to say 18 years old, and it's been the only toothbrush I've ever used in my entire life. So probably, I think I've been using the Sonicare line for like over 20 years. So yeah, it's been a long time. So yeah, I think it's a great toothbrush. So I usually recommend it to my patients. Also, I go over flossing with them because the toothbrush itself is going to do a great job, but everything that happens is happening below the gum line, which meaning flossing is just so crucial in order for you to get the best results. So my patient was actually very compliant. We as hygienists don't always get this. I know you guys like to tell us that you floss every day. We know if you're doing it or not. Just saying, okay? So I'm gonna throw that out there, okay? Don't lie to your hygienist. We know when you're lying. We're just like, yeah, we know if you're flossing or not, because it's a telltale sign if you are, if you're not. But you know what, actually, I take that back, because some people don't know how to floss properly. And sometimes when I have to re-show them how to floss, like, oh, I never used to floss like that. So I guess you sometimes are telling the truth, but maybe just not doing it properly. So, okay, so I'm not gonna be that hygienist that like bashes you for not flossing your teeth. I'm just throwing it out there. Okay, so, all right, so let's see. I'm gonna show you now the after photos from the results once my patient had the procedure done. The procedure, by the way, it's called scaling and root planing. And what we do is we have to get the gums numb in order to clean all that out. Because if you look at that first photo, just think about how inflamed that gum tissue is. And in order for us to clean that all out, you want to be comfortable. And also, if you are someone who has some type of dental anxiety, I would definitely recommend that you do find a dentist that supplies some type of sedation. At my office, we are a sedation office. We do all forms of sedation to make our patients feel comfortable. And in this case, with this young man, we just used the laughing gas, the nitrous oxide, and it made everything so easy for him. He pretty much was like sleeping during the procedure, you know, and he was that comfortable. So it all depends on the individual. The nitrous itself might not always work for you if you're super high anxiety, but if you're like, you know what, you're just like, you know, I kind of don't want to be here, but I don't mind being here, that's a good option to go with. So you just have to find what form of sedation is going to work best for you. And like I said, I recommend that you find a dentist that does supply that for you. All right, because it'll just make your entire experience of having dental work done so much easier. Trust me, I'm a fan of it. I always tell everyone to go and have it done if they are afraid of having any dental work. Okay, so now let's look at these results. All right, so let's start on the bottom teeth because those were the worst. As you know, there was just so much buildup there, so much inflammation, and I want to show you the results after the patient had the procedure done. And now that he's healed for a month and he's improved his home care, which also plays a crucial role in the results themselves. Because if the patient isn't compliant and not doing the work at home, he's not going to get the results that we're looking for. So yeah, let me show you these results. So as you can see here, his gum tissue looks phenomenal. It's healing, and I can still see that it's not completely tight and firm like I would want it to be because he's still in the healing process. It's only been a month. Mind you, this damage that has been occurring, it's been occurring for years. So now his gum tissue still has to go through the whole healing process in order to get it healthy again. So as you can see, the tissues are nice and pink, they're firm, and this is what we want. In a healthy mouth, if you don't see this, there's something definitely wrong. In his case, it's an advanced case where you can see as much, you know, inflammation that he had. We as people, like, you know, people who are just like, you know, used to, you know, flossing a few times a month and brushing every day, chances are there's something going on below the gum line that you can't yet see. Because what happens is if you're not getting your teeth clean, you know, twice a year or whatever the case is where you stand with your recalls, you are still going to build up that bacteria below the gum line if you are flossing a few times a month and you're not doing it daily. You are at the risk of also developing gum disease and periodontal disease. So as you can see here, he's been really compliant with his flossing. His gum tissue is nice and firm, it's tight. That's how I want it to look as a dental hygienist because it makes me happy, and it makes me happy when I see my patients putting in the effort, as much effort as I'm trying to educate them, because I do, as a dental hygienist, I want my patients to have this whole body mouth connection. And when I see that, I'm just like, yes, it's happening. I'm very grateful that they're finally starting to realize that it's something that's very beneficial for them. So let's look at the rest of the tissue. You can see that the gum tissue on the uppers also looks so nice and pink and firm, and that's how we want it. Oh, you know, one thing I wanted to show you is during the procedure when I was cleaning his teeth, is he had so much inflammation that his gum tissue was detached from his teeth. And I'll show you this. So the reason why this occurs is because we call it loss of attachment. Meaning that gum tissue, that there's so much inflammation that the gum tissue almost like attaches itself away from it. As you can see here, I'll show you this photo that I actually pulled back the tissue so that you can see all that raw tissue that's underneath, you know, the tissue on what's going on. So you can actually see that inflammation not on the exterior, but also the interior of that tissue. It's kind of gross, but this is what happens when inflammation occurs in the mouth. So inflammation, if I also want to touch base on, if this is occurring in the mouth, this bacteria, the same exact bacteria and this inflammatory response that's happening in the mouth actually gets transferred into your blood vessels and it circulates throughout your entire body. That's why there's a correlation between gum disease, heart disease, diabetes, and certain cancers, and it's all part of inflammation. So if you think that there's this much inflammation in the mouth, just imagine what's going on with it transferring itself throughout the rest of your bodies. I always tell my patients, like, if this bacteria is strong enough to break down the bone around your teeth, because you do lose bone, just imagine what it's doing to your soft organs, right? Like if the same bacterial process and inflammation is occurring in your mouth, think about what it's doing to your things like your livers, your kidneys, your lungs, and everything else, in your heart, even your brain, because there's also this correlation with Alzheimer's as well, because it's inflammation in the mouth, right? And like that plaquing inflammation in the mouth, it's kind of like Alzheimer's, right? Alzheimer's is like, it's a disease process of inflammation and plaque buildup in the brain. So, you know, there's your connection right there. And I think it's important for us to have this whole mouth to body connection. What I'm trying to do is get you to understand that just because you have these two entities of insurance, which is medical insurance and dental insurance, you think they're two separate parts of your whole body. So, and I think that's where we have this misconception that that there's this disconnect. It's because of a lot of it has to do with insurance, where people will say, well, I'm not going to go ahead to the dental office because I don't have insurance. You can still go to the dental office. You don't need insurance. And so if you sit and you have that mindset and you neglect yourself for years, all you're doing is you're just causing so much disease to build in your body because of this misconception. So that's my talk today with you guys. I think it's important to, once again, have this whole mind-body connection. And I'll see you guys at the next video. I don't know what I'm gonna do next, but I wanna continue these videos. If you like this video, please share it. If you know someone that's kind of going through the same thing, or if you know someone whose teeth kind of look like this, and you don't want to say something to them, but you can send them the video, I guess, and just be like, hey, I just saw this great video, and you know, maybe you might want to watch it. You know, help your friend out. Don't let your friend lose their teeth, because that's what will happen. All right, guys. All right, so I'm signing off. Nice seeing you guys. I will be back soon with a video. I don't know when it's gonna be. Procrastinator. Not that I'm a procrastinator. It's the balance, the life work balance / video thing. So hopefully I'll do one very soon. I promise. All right, guys. Bye.